In this audio, I will begin with Chapter 58 on page 1199, Care of Patients with Liver Problems. When we're talking about nutrition therapy, we want to make sure that any patient that has abdominal ascites is placed on a low sodium diet. It's typically 1 to 2 grams. Need to make sure that we're explaining to this patient why the sodium is being restricted, okay? And we also need to explain to them that they don't need to use table salts anymore, that they can use pepper, lemon, oregano, different spices like that to add flavor to their food, okay? Most of the time, these patients will need vitamin supplements, either added to their IV fluids or prescribed as oral vitamins. As far as drug therapy, patients will have most likely be prescribed diuretics. We want to make sure that we're weighing the patient daily, measuring our intake and output, and assessing electrolyte levels. It's important to remember that these patients can develop spontaneous bacterial peritonitis, and that results from bacteria that's collected in those ascites. The patient typically presents with a low-grade fever and loss of appetite, may have abdominal pain, fever, and a change in mental status. Okay, we want to make sure we're assessing that abdomen. We're inspecting, we're auscultating, okay, we're feeling of that abdomen. Paracentesis can be done. On page 1199, there's a chart, 58.1. It talks about the patient with paracentesis. Whenever the patients have the paracentesis, it's typically done with an ultrasound, guided with an ultrasound for safety. Now, the paracentesis will help to drain the fluid from the patient's abdomen. Sometimes the patient may go home with a tunneled drain, and you'll have to teach the family and the patient how to drain the fluid at home. Okay? If spontaneous bacterial peritonitis is suspected, then whenever we perform the paracentesis, we want to make sure that we're getting a sample of that fluid. Okay? These patients, we also need to remember respiratory support. They can suffer from hepatopulmonary syndrome. Dyspnea can occur, and it limits the thoracic expansion for the patient. Okay, we want to make sure we're auscultating those lung sounds, checking those oxygenations, saturations, and assessing the patient's breathing efforts. It's important to remember that patients with ascites, they are at a higher risk if they undergo surgery. Non-surgical procedures can be used to control long-term ascites and to reduce variceal bleeding. Now, when we talk about interventions on page 1200, esophageal varices, they're typically detected by endoscopy. Any patient with cirrhosis should have an endoscopic procedure to help detect esophageal varices before they bleed. Because remember, we talked about in class that patients with esophageal varices, sometimes they don't know that they're bleeding. Okay. Now, as far as drug therapy, we want to prescribe these patients beta blockers to help prevent bleeding. Okay. Patients with cirrhosis, they and a GI bleed, they should receive antibiotics whenever they're admitted into the hospital, because infection is one of the most common indicators for a variceal bleed. Okay, vasoactive drugs are also given to these patients. If bleeding does occur, endoscopic procedures can be done to stop that bleeding. Now, these patients should have a moderate amount of protein and fat foods and simple carbohydrates, okay? Remember that with their liver is failing, they can't metabolize drugs as well, okay? A lot of the times, patients' ammonia levels are going to want to be reduced, and we see prescribers provide or providers prescribe lactulose to help that patient excrete that ammonia. Okay, We want to make sure we're frequently assessing for any changes in level of consciousness and orientation for these patients. We have to remember about encephalopathy. Now, on page 1202, there is a chart about patient and family education preparing for self-management related to cirrhosis. We want to make sure that we're teaching them nutrition therapy, drug therapy, abstaining from alcohol. If they're going home with a drain, we want to teach them how to access the drain and remove the extra fluid, okay? Whenever they are removing fluid from a home drainage system, we want to make sure that they're not removing more than 2,000 mLs at one time, okay? If the patient has a great loss of fluid, they can suffer from hypovolemic shock. Want to make sure these patients are also avoiding any excessive vitamins and minerals, such as fat-soluble vitamins, iron supplements, and niacin, because they can be toxic to the liver. And remember, our liver is not functioning as well as it should be. We want to provide instructions for these patients on diuretics, okay? We want to teach them about the side effects of diuretics. I will begin in the next audio with page 1203.